Hi everybody, my name is Drew Moranis. I'm a person in long-term recovery and I'm a recovery-friendly workplace coordinator for SOS Recovery Organization. Thank you for coming. We're just going to talk about a few different possibilities as far as warning signs go for someone you think might be using substances or struggling with substances. These characteristics and traits do not guarantee that someone is misusing substances. They're merely possibilities. Some warning signs may include changes in behavior, loss of interest in certain activities, or someone that's overly enthusiastic, extreme agitation, or someone that's extremely relaxed. Missing for long periods of time, especially in the bathroom, might be a warning sign, or secretiveness and sudden isolation. Other warning signs might be changes in appearance, extreme weight loss or weight gain. Another indicator might be someone that appears suddenly unhygienic. They have needle marks, burn marks, or discolorations in the skin. Also, the pupils can be a big indicator if someone is using substances. Sometimes the pupils are dilated, which means they're larger than normal. Sometimes they're smaller than normal, or pinpricks. Sometimes we call that pinned out. Also, the eyes can appear red and glassy if someone is using substances. Another indicator that someone might be using substances is changes in finance, the sudden appearance of money, or if they're asking for money. In the workplace, other indicators might include a sudden drop-off in productivity or an increased involvement in workplace accidents. Now, what is recovery? There's many perspectives and many ways to think about what recovery is. There's perspectives from the clinical perspective, the pop culture and media perspective, lived experience, and then there's also the collective wisdom of people in recovery, researchers, and thought leaders. One such statement about recovery from one of these groups is from SAMHSA, 2012. Recovery is a process of change through which people improve their health and wellness, live self-directed lives, and strive to reach their full potential. There's another more recent perspective on recovery that came from a group in 2019. Recovery is an individualized, intentional, dynamic, and relational process involving sustained efforts to improve wellness. These two statements are more similar than they are different. They both indicate a process of increasing overall health and well-being because, as we know, recovery is holistic. It treats the whole person. Now, what can we do? First and foremost, we can be supportive of those with SUD. Another guiding principle of recovery is that it's based on respect. We can continue to learn what you're doing right now. We can learn more about substance use disorders, what it is, why it's a disease, and about recovery. We can also connect with a series of local resources. Some of those local resources include public health networks, recovery centers. You can find an interactive map at newhampshirerecoveryhub.org, which will give you local services in your area. Drug-free community coalitions, 211 New Hampshire and The Doorway New Hampshire, and organizations like New Futures. We can practice self-care. It's difficult to be there for others if you don't take care of yourself. We can follow asset-based approaches. That means focusing on people's strengths rather than their difficulties. And we can create a supportive and stigma-free community. Recovery Coach Academy is another great way to discover more about multiple pathways of recovery and about different aspects of substance use disorder. Stigma is a combination of a label and a stereotype generalized to a group of people without regard to their individuality. It is more or less a mark of shame designed to discredit and devalue an individual. Substance use disorder is certainly one of the most stigmatized conditions in the world. It impacts public support and opinion, and it can be internalized by an individual. Reducing a person to nothing more than their difficulties is one of the most damaging and dehumanizing forms of language. It denies the existence of any facet of the person, any relevant roles or characteristics other than their diagnosis. This goes back to taking an asset-based approach, not defining people by their difficulties. Stigma does lead to discrimination. Now, what is discrimination? Discrimination is the actual manifestation of actions that people take when they believe a stereotype and then associate the label with others, as in stigmatizing them. Some examples of discrimination against those with substance use disorder and those living with recovery are denial of housing and employment, bullying and/or harassment, a condition, rule, or policy disproportionately impacting only certain individuals. Some other examples of discrimination in the workplace might be a general distrust for someone or getting passed up for a promotion or a raise. Now, the impact of this stigma is very broad, very far-reaching. At any given time in the U.S., there's over 20 million people that fit the criteria for having a substance use disorder. Now, out of that 20 million, or about 10% of the U.S. population, only 15% actually access resources or try to access resources for their substance use disorder. That leaves 85%, or roughly 17 million people, that never try and access services. Why such a large number? Because of the stigma. For fear of what others might think at their job, their personal lives, their family, and friends. There's a lot of examples of how this stigma can affect someone's recovery and the treatment that they receive. Now, the impact of the stigma goes far beyond just the workplace and our friends and family. It can actually affect the level of care we get. Here's an example from 2010, where a survey was given out to over 300 people of 35 questions. The survey was about 2 people actively using drugs and alcohol. One of these people was referred to as a substance abuser, the other as having a substance use disorder. When given this survey, participants were asked to pick one, both, or neither of those subjects, and questions such as, which one of the following people would be more likely to blank? As in, which one of these people, the substance abuser or the person having a substance use disorder, would be more likely to benefit from professional help? Or which one of these subjects would be more likely to commit violence against themselves or others? And which one of these subjects has control over their actions? The overwhelming majority of people chose the substance abuser as being personally responsible for their condition, as benefiting from punishment, as having tendencies of violence towards themselves or others, and the solution to their substance use was morally based rather than medically based. What we can gather from this is that exposure to the term substance abuse elicits more feelings of punishment and more feelings that the subject has control over their actions. Exposure to the term having a substance use disorder elicits more therapeutic medical feelings, as well as feelings that the subject has little to no control over their actions. A second study was done in 2018 by the Journal of General Internal Medicine. 2 charts were written up, both of the same individual, a 28-year-old with sickle cell anemia. All the medical information on these 2 charts are identical, so is the patient. The difference in these charts was that one had stigmatizing language and the other had neutral language. For example, on the stigmatized language chart, there was language on there that casted doubt as to the severity and the condition of the subject. It provided irrelevant details. It suggested patient responsibility for their condition, and it also used different terminology, as in narcotic versus opioid on the neutral language chart. Another example of the language change was on the stigmatizing chart. They would state they refused oxygen, and on the neutral language chart, they would state would not tolerate oxygen. When these 2 charts were passed out to a group of physicians in training, they found the general attitudes of these physicians in training were far more negative for the stigmatized language chart. They also had changes in prescription habits. They were less aggressive with their pain management. So what we can gather from this is that exposure to the stigmatizing chart enacted more negative attitudes towards the patient, as well as different behavior when it comes to prescribing medication. Now, these are some examples of how greatly stigma can impact the level of care that somebody gets. We can also have a big difference in how people are treated, those with substance use disorder and recovery, when it comes to our daily interactions when talking about recovery and substance use disorder. Here's some alternative phrases and terms that you might be able to use in certain scenarios that includes person-first or person-centered language. What that does is it literally and figuratively puts the person before the condition, such as person with a substance use disorder as opposed to addict, junkie, or druggie, person in recovery as opposed to ex-addict, person living with addiction as opposed to battling or suffering from an addiction, person arrested for a drug violation as opposed to drug offender, person with a felony as opposed to felon, choose not to at this point versus non-compliant, medication as a treatment versus medication as a crutch, had a recurrence of substance use rather than relapse, maintained recovery rather than stayed clean, positive and negative drug screen as opposed to dirty and clean drug screen, and substance use or misuse as opposed to substance abuse. We already saw how powerful that word abuse can be. Notice that a lot of these phrases have person that comes before the condition. Another great tool for learning what language is appropriate in what setting is this recovery dialects chart. In different settings, you will find that different people use different language. So you can use this as a quick reference guide to find out what might be appropriate in the setting you're in. For example, in a mutual aid meeting, more popular ones include NA or AA. You might find terms used often such as relapse or alcoholic, whereas in a medical setting, you should not use those terms. Substance use disorder is the preferred term. So these are just some different ways that we can have a direct impact and lessen the stigma on people with substance use disorder and in recovery that you can start practicing right now.
So now we are going to kind of tie everything together and watch a video that comes from the physician Dr. Gabor Mate, the Canadian physician. And in this video you might hear him using some of the not person-first or person-centered language that we just covered, but you can just kind of keep that in mind and be aware of like all that information and knowledge that you've just gained. And so I really like this video because it kind of poses some questions around substance use disorder and recovery that maybe are not common, and kind of invites us to think about how we all might kind of have an addiction to something, whether it be a substance or not, and kind of asking what leads people to have a substance use disorder. So I hope that you enjoy that video, and then we will see you back here when it's done.